Good evening.
Hello.
Hi. My name's Shelly. I'm going to be your nurse practitioner today. What brings you in?
My nose is stuffed up.
Your nose is stuffed up. How long has your nose been stuffed up?
A couple months now.
Couple
Started
months.
around spring.
In springtime? Okay. Does it happen often?
I would say it's been happening for about 2 years now.
Okay. 2 years constantly stuffed up or just during the springtime?
2 years around the same time.
Around the same time. Okay. And for instance, do you have trouble breathing?
No.
Okay. No shortness of breath?
No.
Okay. What about sleeping through the night? You're able to sleep through the night?
Yeah.
Okay. And then during the day, are you able to function throughout the day? Okay. Do you have any pain in your nasal area?
No.
No pain. Any tenderness? No tenderness. Okay. So what about any kind of other symptoms that you may be having that's at the same time?
I do get itchy, watery eyes.
Itchy, watery eyes. Okay. So what I'd like to do is ask you a couple questions with regards to your past medical history, your social history, as well as your family history. Would that be okay?
Sure.
Okay. So past medical history. Do you have any chronic medical problems? Okay.
No.
Have you been hospitalized?
No.
Okay. Any surgeries? Okay. What about any allergies? Do you have any allergies to medications?
No.
Okay. Any food allergies?
No.
Any seasonal allergies?
I think just the itchy eyes, maybe.
Itchy eyes. Okay. Any allergies to cats and dogs?
No.
Okay. Also, do you take any medications?
No.
No medications. Do you smoke cigarettes?
I do.
You do. How often do you smoke tobacco?
About a pack a week.
Pack a week. And for how long have you been smoking?
Almost 10 years.
10 years. Okay. What about any alcohol? Do you drink alcohol?
No.
Okay. Do you do any recreational drugs?
No.
Okay. I'm gonna just go through like a range of systems. For instance, do you experience any headaches?
No.
Okay. Any tenderness in the face, maybe up at the top of your forehead or underneath your eyes or nose?
I wouldn't say tenderness, but when it's stuffed up, that's where it's located.
Okay. And then any issues with your neck or behind your ears?
No.
Okay. Any trouble swallowing?
Nope.
Okay. And then you did say that you experienced itchy eyes. Did you have anything else going on with your eyes, any other than the itchiness? So what I'd like to do is do a physical exam. I'd like to take a look at your head, your eyes, your ears, your nose, your mouth, and your neck. Would that be okay?
Okay.
Okay. So I'll begin by looking at your head. So what I'm doing is I'm just looking at the hair distribution. I'm going to look at the front as well as the back. Now I'm going to look at the other side. I'm looking at hair distribution. I'm looking at the shape of your skull. I'm also looking to see if there's any infestations. Again, I'd like to touch your head. Would that be okay? Okay, I'm going to start from the front and work all the way back to the occipital part of the skull. I'm looking for any deformities, depressions, any masses, tenderness. Do you have any tenderness?
No.
Okay. I'm also going to look at the hair texture, and I'm looking also from the front to the back of the head. All right. Okay. Now I'd like to work down and look at the face. I'm inspecting the face. I always inspect first. Looking at the face to make sure that your face is symmetrical. And that there isn't any involuntary facial movements. If there's any tics, unnecessary tics or any scarring, lesions, or any other discoloration. The other time, now I'm going to palpate your sinuses. I'm going to palpate the frontal sinuses as well as your maxillary sinuses. I'm working towards your temporal pulse. Your temporary artery is right here. I'm just making sure that there's no thickening, hardening, any tenderness.
No.
Okay, great. All right, I'm going to work down to the temporal mandibular joint. What I'd like to do is get you to open up your mouth, open and close one more time. Great. I'm looking to see if there's any crepitus. Let's see here, tenderness, no popping, locking, and everything seems to be fine here. I'd like to do a test. What I'm going to do is take a cotton ball, I'll get you to close your eyes. When I touch your face, I'd like you to tell me when I touch it. Okay. Get you to close your eyes. Tell me when.
No.
Great.
No. No. No.
Great. My next test, I'm just going to get you to follow a couple commands. If you could raise your eyebrows really high, close your eyes tight. Let me get you to open them. If you can show me your teeth. Great. If you can pucker your lips like giving a kiss, and then puff it out, puff your cheeks out. Great, and then let me just see your smile. Perfect. My next test, I'm going to test, I have a couple of applicators. 2 applicators, it's, each one will have a different taste. I'm going to just apply one applicator onto your tongue and get you to let me know what the taste is, and then we'll do the second applicator.
Sure.
Okay, I'm going to get you to stick out your tongue. Okay. Sweet, sweet. All right, our second applicator.
Salty.
Salty. Great. Thank you. Well, let's work towards the eye. So I'm going to inspect first with the eye. So I'm looking at your eyebrows, your eyelashes. There isn't any crust. I don't see any crusting there. I'm looking at the lids of your eyes. I'm looking at the lower lids, the conjunctiva here, the lacrimal apparatus, and then I'm palpating, and everything seems to be fine. I don't see any edema, any tenderness.
Nope.
Okay, I'm looking at the scleria. It's white. It's not yellow or jaundice. I don't see any watering or anything, so it looks pretty good. The next is I'm going to get you to actually to follow a light. I'm going to just inspect your pupils. I'm just looking at your iris, your pupils, your cornea, bilateral. The next, I want to get you to follow another command, and that is to cover one eye, and then I'm going to get you to follow with the other eye my finger. So I'll get you to cover one eye for me. Okay, and then I'll get you to look at my finger. And then up, down, and then back to middle. Up, down, back to middle. Let's do the other one. Up, down, middle, up, middle. Perfect. Thank you very much. The other is I'm going to get you to do, I want to test your visual fields. So this one's a little interesting. It's your peripheral vision. So I'm going to put my hands behind you, and when you see my finger, I want you to tell me when.
No.
No? Okay, we'll go to the other one.
No.
Okay, I'm going to do the posterior and superior, so just tell me when you see it.
No.
Great.
No.
Great. All right. One is I'm going to look directly at your eye, and I'm going to shine a light into your eye. I want you to look directly at the light, and then I'm going to actually come in, but keep a direct look at the light. Great. Perfect. Thank you. And then now I'm going to shine again the light, and then I'll look at the other eye and just make sure that your pupils are reactive to light, and they also do accommodate. And they're nice and round and equal. I'm going to look at your ears. All right. So I'm looking at the placement of the ears to make sure that they're symmetrical, which they are. I'm looking at the external canal to make sure that there is no drainage or discharge or any signs of infection or inflammation. I want to look at the inside of your ear, but before I do, I just want to tug back to see if you feel any pain or tenderness. So I'm just going to pull the pinna and then tuck back. Take a look. Do you feel any tenderness there? I do not see any sign of redness on the external ear canal. All right, I'm just going to take a look and shine a light. And take a look at your ears. I do want to pause after I take a look at your ears and then re-look and examine your eyes since I have my scope out. So I'm going to pull up and back. I'm just taking a look here. What I'm looking at is the internal ear canal. I'm looking at the tympanic membrane. Inside, I'm looking at any kind of redness, bulging. I'm looking for any wax buildup, as well as any foreign bodies. Let's take a look at the other one. Pulling up and back. Again, I'm looking for any wax buildup. It's nice and pearly white, which is great. I'm looking to make sure there's no redness or bulging, any excessive wax buildup or foreign bodies. Looks good. See all the tympanic membrane as well as the internal structures. Take a look at again at your eyes. So I have my scope here. We're gonna visualize your eyes here. So I'm just gonna shine a light into your eye. I'm just gonna come here at an angle. I'm gonna look at the red reflex and then just follow through in. I'm going to visualize blood vessels, the optic cup, the optic disc, and the macula. Look at the other eye. There we go. Again, they are equal. I'm visualizing blood vessels, the optic cup, the optic disc, and the macula. Thank you. Let's go back to the ear exam. What I'd like to do is perform a couple of tests. One is the whisper test. What I'd like you to do is cover one ear, and then I'm going to be about 2 feet away from you, and I'm going to whisper a 2-phrase syllable. Pumpkin. Pumpkin. All right, next is the Weber and the Rennie test. So this, what I'd like to do is the Weber test first. I'm going to hit the device, and then I'm just going to place it right here at the crown of your head. What I'd like you to do is let me know if you hear or feel the vibrations. Sure. Or hear or feel anything. Hear a buzz. You do? Okay. Do you hear it in both ears, one ear, or the other ear? Both ears? Okay. All right. The next is the Rennie test. What I'm going to do is I'm going to hit it, and then I will place it on the bony area of the back of your ear. And then once you stop hearing it, I want you to let me know. And then what I'll do is then put it in front of your ear, and at that time, let me know when you stop hearing it.
Sure.
Okay.
Now. Now.
Great. So what we're doing is air conduction is greater than bone conduction. Let's do the other ear.
Now. Now.
Great. All right. Well, let's move to the nose. What we're going to do here with the nose is I'm going to just inspect from afar. I'm looking for any deformities. I'm looking at both nares to make sure that they're equal. I'm looking at the ala on both sides. I don't see any abnormalities. I'm also looking at the tip. Let me get you just to flex your cover here for our machine, our scope. On. And what I like to get, I'm just going to look at the internal nasal passage here. So I'll just get you to flex forward, up. And I'm just going to take a look. What I'm looking at is the internal, like the mucosa of your nair. I'm looking for any polyps, making sure that there's the septum, there's no deviation. I do see some clear drainage. Clear drainage is noted in both nares. So. Okay. What I like to do is just test the patency because you have said that your nose is stuffed up. So I'd like you just to close one nostril and then breathe out. Great. I can hear it. The other one. And then breathe out. Okay. So that one, it seems like one nair is a little bit more than the other, but you do sound like you are, you do have some congestion. The other thing that I'm going to do is I'd like to do a test on your smell. So I'm going to put just one smell against one nostril and get you to identify it, and then the other smell on the other nostril and get you to identify it. Here's one.
Citrus.
Citrus. Okay.
Having a little trouble spelling that one.
That okay. Okay. All right. That one is the one that's a little stopped up. So then I'm going to move down to your mouth. So I'm looking at your lips. I'm looking at the external to make sure that there's no crusting. I don't see any lesions, sores, any dryness, any cracked lips. And then let's take a look at the inside of your mouth. So I'm just going to take a look, open up, stick your tongue out and say, ah. Great. I'm looking at your cheeks. They're nice and pink and red, slightly red, looking at the back. I see your tonsils. I also see your uvula, which is midline. Everything looks pretty good. I'm looking at your, open up one more time, your soft and hard palates. Let's see here. Go ahead and stick out your tongue again. I don't see any masses. Lift up your tongue or lesions. I am observing that you do have saliva, which is great. And then I do see your submandibular as well as your sublingual ducts. That's good. No trouble swallowing?
No.
Okay. Let's move down to the neck, which is our last. And I'm just looking at neck alignment. I'm looking at your trachea, which is midline, as well as I don't see any masses, any lesions, no goiter. I don't see any sign of torticollis. I'm going to do a test, a resistance test, as well as includes range of motion. What I'd like you to do is I'm going to ask you to lift up your shoulders up to your ears. And then I'm going to actually push down onto your shoulders gently, but I don't want your shoulders to go down. I don't want any, see what kind of resistance you have. So go ahead, lift up your shoulders. I'm just going to push down. Perfect. Next is I'm going to move your neck, or I'd actually get you to turn your neck. And then I'm going to try to pull your head towards me. And I don't want you to let me. All right, so go ahead and turn. Perfect, let's go the other way. Great, all right. What next is I'm going to palpate your lymph nodes. So I'm going to go all the way from your back of your head to your jaw to your neckline area. So I'm going to go and feel your occipital lobes. And what I'm doing is I'm taking 3 fingers here and I'm gently moving in a circular motion to see any enlargement of any lymph nodes. So I've got the occipital lymph nodes, I've got the post-auricular lymph nodes, pre-auricular lymph nodes, which is in front of the ear, the parotid, submandibular, and then I'm moving towards the chin for the submental lymph nodes. Great. Next is I'm going to go down the substernocleidomastoid muscles to feel the anterior cervical nodes, to the posterior cervical nodes. Hard. Let's see here. And then the supraclavicle deep nodes that are right here along your clavicle. What I'm looking for is to make sure that there's no enlargement. They're not fixed, that they are movable. If I do feel something there, that it is movable, that they're not hard. Did you experience any pain or tenderness when I did that? So that's a good sign. So everything looks good there. Next is I'm going to examine your thyroid. So what I'd like to do is I'm just going to place my fingers here on each side of your trachea, and I'm going to just kind of move back and forth, and it is midline. Next is I'm going to come behind you. I'm going to place my fingers here below the isthmus of your trachea. I'm going to feel the cricoid cartilage, and I'm just going to kind of move here and then feel your thyroid here. What I'm looking for is to make sure there's no enlargement, any nodules, anything that is any bumps, tenderness. Did you feel any tenderness? Okay. All right. So thank you for letting me examine you this evening. I'd like to finish my examination by giving a verbal report. This is Alana here. She's a 26-year-old female. She presents with a stuffy nose. She's had the stuffy nose that has happened pretty much, yearly, seasonally, specifically during the springtime. It does not have any pain or other symptoms for her. She's able to breathe okay. She's not in distress. She can pretty much sleep at night and function throughout the day. She does have some itchy eyes on occasion. She does smoke a pack a week of tobacco. Denies any use of alcohol as well as illicit drug use. Her family history, which we did not discuss, Do you have any family history of any of the same symptoms that you're experiencing?
My mother and my aunt.
Okay, so we have a mother and a maternal aunt that also has seasonal allergies with the same symptoms. Review of symptoms. Our patient here is in no respiratory distress. I don't see any work of breathing. She is not complaining of any headache, pretty much just a stuffy nose and watery eyes on occasion during the spring months of the year. She does, on examination, she did have a hard time smelling a certain smell that I would probably follow up on at a later date, just because she seems pretty stuffy. At one of the nares, actually it was the right nair that she was having a hard time smelling. On the internal exam of her nasal passage, she did have some clear drainage that was just a little more excessive than normal. And then it did come into the office with, Kleenex and actual draining. So that's my exam findings. I think that our patient here is experiencing seasonal allergies, and that a over-the-counter medication would probably be beneficial, and that I would recommend that if symptoms did worsen, that she would come back here into the office. I'd also then go into detail about respiratory distress and what to look for and when to seek medical treatment, emergency medical treatment. Thank you so much, and I hope I did it within 30 minutes. Thank you.